This particular 2-week training is for improving the capacity for vector surveillance in the national malaria control programs across the malaria endemic countries in Asia Pacific. And the reason for that is that vector control remains one of the most important ways of combating malaria. In high transmission areas, vector control is the single most important way of combating malaria. And you cannot do vector control if you don't do proper vector surveillance. You need to understand which species of vectors on a particular area, because they all have different breeding preferences, biting behavior, biting time preferences, and you need to understand, are these mosquitoes mainly biting indoors, in which case bed nets will work, indoor residual spraying will work, but if they're biting mainly outdoors, you have to think of other ways, because then the bed nets and the indoor residual spraying won't be that effective. You need to be able to do effective insecticide resistance monitoring, because if you are using vector control tools based on a particular insecticide to which the mosquitoes have become resistant, then you're wasting your money because the insecticide is no longer effective. And there have been multiple surveys since about 2018 published in international journals that have shown that vector control or vector surveillance capacity across the world, South America, Africa, and including Asia Pacific, vector surveillance skills are not what they should be to enable malaria control programs to be effective. Remember, we said that malaria control is largely based on vector control. And vector control, to be effective, must be supported by vector surveillance, effective vector surveillance.
On behalf of the faculty of Tropical Medicine, Mahidol University, we are very grateful to contribute on the APMEN Asia Pacific Malaria Elimination Network to arrangement of the vector surveillance for malaria and other vector-borne disease in Thailand. This is very good opportunity for all of the total 7 country partner in Asia Pacific, even also in the Papua New Guinea, to share the experience together. What is the situation of the malaria, what is the capacity strengthening, what is the gap knowledge that we found in our own country. And then we have learning what about the news update of the knowledge in terms of the vector surveillance, the guideline of the vector control, and also we looking for the potential network to expand on our strengthening capacity. So we hope that in part of the Department of Medical Entomology, we also take the advantage to contribute and training of the new generation for the new generation of the medical entomologists. So I hope this one will fulfill as the big gap problem of the malaria elimination. So I think in the next time, Mahidol University will be the part of the contribute of the malaria elimination. Thank you.
So we're having this malaria vector surveillance training in Thailand, which is in Bangkok and Ratchaburi province. So this training aims to enhance knowledge and experience for public health entomologists and also vector control staff and MCP staff on how to do vector surveillance, so that hopefully they can bring this knowledge back to the country and then try to train other entomologists in the country how to do the vector surveillance better.
I'm glad to join this training because this training is very useful for entomologists, and sometimes if you not entomologists, you can join, you can attend, because this is focus on about the vector surveillance and vector identification, especially the mosquito. If you have know about the mosquito vector, you have to use them for control the mosquito and vector control in the same time for the disease control. It is very useful for joining this training. Thank you.
This training is very useful for the participants. We plan for two parts of malaria entomology. First is field entomology to study about the biology, adult biting behavior, how to trap them, how to carry them from the field to the laboratory. And for the laboratory study, we study on insecticide resistance and testing about response of the mosquito to our applications. For my expectation for the participants, we hope the participants can use this knowledge for control, for testing about the mosquitoes, and can help the people in their country for controlling the malaria until the malaria can eliminate.
For me, I work in entomology is maybe more than 10 years, but normally I focus on about insecticide testing. So in this one, it have a good chance for me to refresh my knowledge. After I have training, or not training, after I maybe after I join that, I feel that one is good for me to refresh the knowledge of this, because everything now we need to update some information or some protocol.
And I'm joining the 6th malaria vector surveillance for elimination training course. And as a program manager for malaria, I really appreciate being a participant in this training, because it gives me a lot of learnings and idea about vector surveillance. And of course, this can be applied to our national policies. We can integrate the learnings from this course in our national policies. So as program manager and as also someone new to the program, I really appreciate, because I am being introduced to vector surveillance, and not just only about vector surveillance, but we've also learned so far about community engagement as well. So that is also a very important factor in the control and elimination of the malaria. So I really appreciate all the organizers of the event, the APMEN, the Mahidol University, and all the other organizers. Thank you for this opportunity of joining and being a participant in this training course.
For this training, I'm responsible for human landing care station in Station 2. All participants have learned about how to collect mosquito using human bait catch technique. So everyone very happy to learn about this technique. And I hope that participants will use this kind of experience to use in their country. Thank you so much.
I'm very special to participate in this training, because before the training, whenever I go to the entomological surveillance in my countries, I just prepare the tools and just go for the fees and take appropriate methods and just take a sample. But after this training, teach me before go to the surveillance, entomological surveillance, what do we want to know, what the question is, and to answer these questions, what indicator we should use, and how the sampling method we should use. So after these trainings, before entomological surveillance activities, I can know how to do the systematically these entomological activities, and I know the importance of the vector surveillance in the malaria control program. So after this training, of course, when I come back to my country, Myanmar, and I must share this concept, basic concepts of the entomological surveillance to my colleagues and my seniors, my juniors, and the new generations of the entomologists. And then by this systematic entomological surveillance, and by thinking about what do we want, and based on these questions, we plan to do the relevant indicators, to find the relevant indicators, and to do the appropriate and relevant weather surveillance activities, and so I think the Myanmar can be reached malaria elimination one time. Thank you.
First of all, I would like to say thank you to UPMAN and Mindol University for facilitating this very important training. Like for PNG, this training on the malaria vector surveillance for malaria elimination is very important. At this point in time, we need this kind of training because at the moment, PNG, we have a lot of malaria cases, almost to 1 million cases last year. And we are still fighting to reduce malaria in Papua New Guinea. And we are using the vector control tools like ELIMINATION, diagnosis and treatment, but cases are still right up there. So I think for this workshop, probably we have learned a lot because vector control is a very important tool. Because you got to know your malaria vectors and malaria composition. I mean vector composition. You got to fully understand, and then before you start the intervention, it is always you must know your vectors that around your community, around or in your country, and then you plan properly, and then you bring in the interventions that will reduce the number of vectors. So this training is timely and it's very helpful. Like the rest of the Asia Pacific countries eliminating malaria, and PNG still we are fighting for this very pandemic. I mean the disease that has been around for so many years, and we are trying to manage it, and we're still under control. I mean we are controlling the malaria cases, while the rest of the Asia Pacific we have seen there's a lot of progress and into malaria elimination, while we still have big number of cases. Like for PNG population is almost 10 million population, and we have 1 million malaria cases every year. That shows that we have about 10% of our population is affected by malaria, and so we have got a lot of work to do, and especially in the space of malaria vector surveillance, I think we need to invest a lot. Probably we need to incorporate that into our strategic plan going forward in the next 5 years. Because as per WHO technical strategy says that by 2016, they formulated in 2016 up to by 2030 they have to eliminate malaria in the Asia Pacific and including Western Pacific, but PNG is still not ready. So I think we need to strategize again, and this training is very important. It will help us to do proper planning and resource allocation for especially in the space of vector control, and probably we reach the elimination target maybe after 2030 or so.